This is CCTA case number 17. The history is that of a 40-year-old man who is a smoker, has a history of high cholesterol, and has had some atypical chest pain. He has a 0 coronary calcium score. Here we have 3 phases for review. Those can be evaluated by changing the forward or backwards control for the individual phases. Let's concentrate first of all on the left circumflex as we rotate around the circumflex. As we come down, we're struck with an idea that there is a sort of fuzzy or irregular area involving the mid portion of the left circumflex. As we rotate around that area, this appears to suggest some eccentric non-calcified plaque. Let's see if we can do a little better with a different phase change. This is a little bit better answer, looking at the different phases. As we rotate about again, we can see that there is eccentric non-calcified plaque involving these regions that appears to be obstructive. Now if we switch from a 5mm MIP, you can see again very eccentric obstructive disease. If we fix to an MPR view, you can even get a better view of this area showing the non-calcified plaque and the focal obstructive disease. Let's take a look at the other vessels. Left main appears to be normal, following the left anterior descending vessel, normal first diagonal, and otherwise normal left anterior descending artery all the way down to the apex. Let's return to the right coronary. Comes off here, passes anteriorly, and then we try to rotate around to get this in a single view. Again, right coronary appears to be very normal as we rotate around. You can see the distal distribution of this vessel. Likewise, normal. Focus on the foot view, and then we can see a normal posterolateral and a small posterior descending vessel comes off in this direction that is normal. So this 40-year-old man who's a smoker has eccentric non-calcified obstructive disease involving the left circumflex coronary artery and should be considered for coronary angiography and likely coronary intervention. Regardless of that, the patient needs to quit smoking and needs to be aggressively treated for his other conventional risk factors.